Okay, first I'm going to verify the order and gather all my supplies, which I already did. I am then going to explain the procedure to the patient and wash my hands. I'm going to go ahead and open my extension tubing, maintaining sterile technique, and then I'm going to attach the normal saline. Then I'm going to go ahead and flush my line, and then I'm going to return it all back to its packaging. Then I'm going to select and palpate my vein, which I did. If the site is hairy, I'm going to clip 2 inches around the area that I intend to use. And I'm going to go ahead and put on my gloves. Then I'm going to go ahead and apply the tourniquet 3 to 4 inches above my intended site, making sure that the distal ends of the tourniquet are away from the site. Then I'm going to go ahead and have the patient lower their arm lower than their heart, and then I'm going to have them open and close their fist. I'm going to make sure I can observe and palpate the vein, and then I'm going to go ahead and release the tourniquet and clean the area for 30 seconds to let it dry. And then I'm going to go ahead and reapply my tourniquet. And then using my non-dominant hand, I'm going to stabilize the vein and avoid touching the site. I'm going to go ahead and take my catheter, making sure that it is bevel up. I am going to insert at a 10 to 15 degree angle until I feel the give. Then I'm going to make sure that I keep it parallel to the vein and wait for the flash. I'm going to go ahead and advance the catheter. I'm going to stabilize release the tourniquet. I'm going to hold 1 inch above the catheter tip and stabilize the hub. Then we'll go ahead and withdraw the needle and put it in the sharps container. And using aseptic technique, I am going to take my primed extension tubing, once I take the cap off, I'm going to insert it, making sure that it's not clipped. I'm going to pull back on the syringe and make sure there's blood return, and then I'm going to go ahead and flush with the saline, making sure there's no infiltrator leaking. And then I'm going to go ahead and remove the syringe. And then I'm going to go ahead and apply my Tegaderm. And then I'm going to label it with the date, time, size of catheter, and my initials. And then I'm going to have the patient return to a position of comfort.